starting at the top, this is going to be the arteries. You're going to see the aorta kind of making its way around there. The two vessels that are coming off of the aorta in the cat are the brachiocephalic artery and the left subclavian artery. Now keep in mind, in the human, you would also have the third vessel here, the left common carotid, but not in the cat. So as we make our way out from there, if we follow the brachiocephalic cranially, deep to these brachiocephalic veins, you would have the right common carotid and the left common carotid. The other branch of that brachiocephalic down here, deep to all of this, is your right subclavian. You can faintly see it there, right? And then this would be what goes out to the arm. And then you would have your axillary and your brachial. For the left subclavian, we're going to follow this out. As we follow this out from the rib cage, that's where it becomes the axillary artery, or the axillary artery. And then as this axillary artery continues, or axillary artery, it ends up forming the brachial artery, going through the brachia. So those are fairly easy to identify. As far as the veins, the same thing applies, right? Here's the brachial vein. As it makes its way back through the axillary region, it becomes the axillary vein. As it enters the rib cage again, it's the left subclavian vein. Where these two merge, that forms the brachiocephalic vein. And those two brachiocephalics merge to form the superior vena cava. And that drains into the right atrium. As we move towards the posterior aspect here, you can see the azygous vein. Right, and this is the guy that's draining pretty much all of the intercostal vessels. As far as the jugulars here, make sure you look at the picture up there for the human anatomy on that, and that's what you're going to see on the practical, if it appears. As we go beyond the diaphragm, right, inferior to the diaphragm, the first artery or arterial branch that you're going to see from this abdominal aorta is going to be the celiac trunk. So here's our celiac trunk. Just caudal to that, you have the superior mesenteric artery. If we continue caudal to that, this is where the inferior vena cava is highly visible. Branching off of that, of concern to us, is the renal vein, along with the renal artery. And this, of course, is branching from the abdominal aorta that you can kind of make out right there. Right, so renal vein, renal artery, inferior vena cava, abdominal aorta. Celiac trunk, superior mesenteric. As we continue to make our way down, you guys have the male? Yeah. These are the gonadal vein. This is the gonadal vein. The artery looks like it was this little guy. Possibly right here. So that one's kind of difficult to see in your cat.
But it's just going to run.
It's a little better. Yeah, it runs along the vein, typically, right? You can see it better on this side. Right? In this case, it's still intact, and you have both of them. You have the vein there, the vein right here, and then the red, of course, is the artery. Right? And you see that in this case, they're males. It's making its way down. Here it is again. Eventually, it comes out right through here to the spermatocord and down towards the testes. Right? So pay attention to that, right? If it's a male, obviously no ovaries. Look for spermatics that are going down towards the testes. If it's a female, you should see the uterine tubes and ovaries in this region. Those gonadals will then be moving out towards the sides. Right? So pay attention to that. The colon we cut, so the inferior mesenteric is not visible, but you can see the nub about right there. So be aware of that for that one. Actually, it looks like this might be. No, that's the nub for this one. Yeah, it looks like that was it. Right, so just be aware of that. Then you have your external iliac artery, internal iliac artery, right there. For the external iliac artery, as soon as that passes through the abdominal wall, then it becomes the femoral. And that's where we're ending with the arteries. As far as the veins coming back, this is the great saphenous vein. That drains into the femoral vein. The femoral vein makes its way back into the abdominal cavity where it's the external iliac. There's a small branch deep to this, right about Right there, you see it? Right. That branch is the inferior, I'm sorry, the internal iliac vein. Those come together, they form the common iliac vein, and then those drain back into the inferior vena cava, and then back to the heart. And I think that's it. Good job, that's pretty good. Hardly anything. Just trying to see what I can use this cap for that for sure. Do you have a piece of paper I can have? Just so I can write. Do you mind if I cut it out?
No.